I'm a urology specialist, and today we're diving into a topic that few dare to discuss but is incredibly important for your health: oral sex. Have you ever thought it's completely harmless? Or believed it's not a real form of sexual contact? If your answer is yes, you're not alone. But brace yourselves, because I'm about to reveal shocking truths that no one has ever told you. Oral sex can pose serious health risks you've likely never considered. Join me as we explore this in depth to protect yourself and your loved ones. First, let's address a widespread misconception. Many people believe that oral sex isn't real sexual intercourse. They assume it's safer and carries fewer risks compared to other forms of contact. But what's the truth? Oral sex is indeed a form of sexual contact, and it comes with risks we're often not warned about. Did you know that, according to a recent survey, over 60% of adults don't use protection during this activity? That's incredibly concerning, especially given the dangers I'm about to share, which can directly impact your health and your partner's. Let's start with an intriguing fact. Your mouth is a complex ecosystem, home to hundreds of different bacteria. Normally, these bacteria are harmless and even beneficial to your body. But when you engage in oral sex, things can change. Under certain conditions, these bacteria can become dangerous. For instance, if you or your partner has a cut, sore, or gum inflammation, these bacteria can enter the bloodstream or contact sensitive areas like the genitals. This creates an opportunity for infection, especially in vulnerable regions like the urethra. Now, let's talk about even more serious pathogens that people often overlook when it comes to oral sex. First is the herpes virus. Herpes can easily spread through oral genital contact, even without visible symptoms. You might not see sores, but the virus can still be present and transmissible. Next is HPV, human papillomavirus, a dangerous virus linked to oral, throat, and cervical cancer. Statistics show that over 70% of oral and throat cancer cases in men are related to HPV transmitted through oral sex. Even more alarming, HPV often shows no initial symptoms, so you might not realize you're infected until it's too late. Additionally, other sexually transmitted infections like gonorrhea, chlamydia, and syphilis can also spread through oral sex if protection isn't used. Here's another critical point I want to emphasize. The urethra, the tube that carries urine and semen in men, is a naturally sterile environment. This means it's designed to be free of bacteria. However, when you engage in unprotected oral sex, bacteria from the mouth can invade the urethra. This is especially risky if your partner's mouth harbors harmful bacteria or if there is an unnoticed small sore. The result? You could develop a urinary tract infection, urethritis, or even worse complications like infections spreading to the prostate or bladder. This is why many patients come to my clinic with symptoms like painful urination or burning, unaware of the cause. Hearing this might make you anxious, but don't panic. The good news is that we can minimize these risks with simple measures. Use protection. Condoms or dental dams are effective ways to prevent transmission. Don't hesitate to discuss using them with your partner. Your health comes first. Personal hygiene. Ensure both you and your partner maintain clean mouths and genital areas before engaging. Brushing teeth, rinsing with salt water, or using antibacterial mouthwash can reduce oral bacteria. Regular health checkups. Get regular health screenings and tests for sexually transmitted infections, especially if you have multiple partners. Early detection allows for timely treatment. Avoid contact with wounds. If you or your partner have sores, inflammation, or infections in the mouth or genital area, pause to avoid spreading bacteria or viruses. HPV vaccination. If you're under 45, consider getting the HPV vaccine to protect yourself from virus-related cancers. Oral sex can be an enjoyable part of your sex life, but don't let ignorance put you and your partner at risk. The dangers I've shared, from mouth bacteria, herpes, HPV, to urethral infections, can all be prevented with awareness and care. Don't let the secrets no one told you become a silent threat. Start making a change today. Arm yourself with knowledge, use protection, and most importantly, listen to your body. If you notice any unusual symptoms, Don't hesitate to see a urologist for advice. Your health is worth more than any embarrassment. Thank you for watching. Please share this video to help others protect themselves too. See you in the next exciting health topic.